My name's Catherine, and this is my story. Any sport that uses the upper body, you keep moving it up and down, and that's what I did with this left side of my left shoulder. Even someone hugging me, they would press on this and tap on this, and it would just ignite a little, it would flare up. It stopped my symptoms a little bit, but I still had pain on the left trap in the back. And I'm prone to headaches and migraines that would make me vomit, like a lot, that I couldn't stop it. I just kept looking to many doctors, orthopedic surgeons, going back to my neurosurgeon, trigger point therapy, stem cell injections, prolotherapy, steroid injections in your neck because I thought it was referred pain.
Diagnosed her with the thoracic outlet syndrome, and so we went to surgery. The pathology in neurogenic thoracic outlet syndrome is primarily compression of the nerve structures where they're passing between the anterior and middle scalene muscles in the lateral neck. It's not compression between the clavicle and the first rib, so therefore taking the first rib out is unnecessary, and not only is it unnecessary, but it creates a lot of additional morbidity and risk for the patient. Basically involves removing the anterior and middle scalene completely and doing a careful neurolysis, which means decompressing and removing any scar tissue or bands or other structures that might be pressing on nerves, involving the entire brachial plexus and all of the proximal nerve branches. And she did excellent with that. She ended up with sort of two spots of pain that were still pretty troubling for her. One was up at the top of the shoulder blade, and one was down near the angle of the shoulder blade, or the bottom little angle. The shoulder blade is kind of like a triangle, roughly. Just a matter of taking her back to the operating room and finding both of these little nerves and disconnecting them, and taking the proximal end and burying them down deep by the spine itself. The pain from those issues is gone, basically. So she's very happy. She's doing great. It's just an interesting example of a patient where they have a big peripheral nerve problem and then a couple of little peripheral nerve problems.
I didn't expect perfection, but I'm very happy with it because what I wanted to get rid of is what I was feeling every day. You trade it for something different, but it's very, very minimal. I feel like life is just more open to possibility where I can do things, and I can't have my 18-year-old body back, but I'm so glad to have a renewed 38-year-old body. I'm just happy that hopefully I can pursue med school and I can read, I learn less medicine, hopefully I'll get off of it totally. And I'm just so happy about that I don't have to think about this all the time and worry about it. I'm just so grateful. I don't know, he's a master at what he does, and it's a godsend that there's someone here that knows and has that skill. I'm just grateful there's a man on earth who knows how to do something like this, and I just wish he would share his knowledge with more doctors because this needs to be all over the place. It's everything I needed and wanted, and I just can't believe it's here. My wish came true.